Welcome to Eagle Creek Golf Club. This is Dr. Justin Coe with Oviedo Chiropractic.
My name is Liam Sullivan and I'm the Director of Coaching here at Eagle Creek, and we're here today to talk to you about how chiropractic care can help you with your golf game. Really, as golfers, we are so guilty of doing really poor warm-ups without stretching. I see it regularly on the lesson tee as I'm coaching every day, and the golfers are arriving to play their golf. It's straight out of the golf cart. It's maybe 2 or 3 swings with a 7-iron, and then the driver's out, and they're trying to pound that thing 300 yards, and it's just not attainable.
Most people at the golf course, as soon as they get there, they're going to grab a golf club, and then they're just going to kind of stretch out by bending over. We do want to do those stretches to stretch out our back as well. It gets blood flow to the muscle, but the most common stretches that people are missing out on are the quad stretch. Quad stretch, you want to hold for about 5 to 10 seconds, and then you want to do, again, both sides, and you want to do about 3 sets of the 5 to 10 seconds. The hip flexor stretch, get a scissored stance. You want your toes pointing forward. Keep the back leg as straight as possible. You want to hold about 5 to 10 seconds on each side. And the last one for the upper body is we really want to stretch those pecs out. And we're just going to pull down on our fingers and reach backwards, so that way we can help stretch out that pec.
I would be guilty of what most people would be, and that is waiting until something is hurting or causing me an issue before going to see. So putting a band-aid over the problem rather than going to see an experienced chiropractor and putting a plan in place.
Teens on up, again, more flexibility, less injuries are involved. So for them, we're working on the core strengths as they're growing. They want to grow into that flexibility and grow into the symmetry that they're working on. 20s and 30s might have had minor injuries going in there. 30s and 40s, we've likely had some injuries in the past.
So the most common golfing injury I would see, and it's something that I've had myself, is wrists. A lot of the time that comes from if we're hitting the golf ball out of long grass and we're trying to dig the golf ball out of a bad lie there, and we jar the golf club into the ground.
Chiropractic treatment can work on extremities, and so a lot of doctors are trained in extremities. Again, working on all the bones to make sure that they're working and moving effectively. Adjustment-wise, we can actually adjust feet, ankle, fingers, but also too, in our office specifically at Oviedo Chiropractic, we can also do a lot of muscle work. We can work on the whole kinetic chain of the neck all the way to the hands, so that way we can get through the golf swing a little bit more effectively.